Back pain sufferers, it's time to get your back back.
I've always had problems in this area.
The pain in my neck is a sharp pain. When I sleep, it hurts, you know. When I turn my head around, it hurts.
In my back, all the way in the left hip, and down to my knee.
That fear in the back of my head that if I do this movement, is it going to hurt?
I would call it a sharp pain.
Every time I try to do things, it just starts hurting again.
Most of my pain is in my shoulders and in my neck.
If I feel this way now, how am I going to feel 10 years in the future?
Do I have to live with this back pain forever?
For thousands and thousands of people, many with pain just like yours, the answer to that question is a resounding no. Is there any reason for anyone to have to live through the suffering, discomfort, and torment experienced by the people you've just seen talking? Now, listen to what they've got to say.
Has changed my life considerably. Having to deal with continuous pain and being free from it is a marvelous feeling.
I can go up steps, down steps. I'm living my normal life.
I've had neck pain for over 10 years due to a car accident and having to have surgery. Now, since I've started the therapy, I am completely pain-free. For me, that was a miracle.
It feels great. I love doing all the things I couldn't do when I had the pain.
If you know what it's like to have serious back pain, this kind of relief can almost seem miraculous. But what they have in common is that they've all experienced a remarkably effective and totally non-invasive back treatment procedure called the LCD Spinal Care System that's offering relief for many spinal ailments. Hi, I'm Andy McCavan, and joining me today is Dr. Min Lee. Good to have you here, Dr. Lee.
Thanks, Andy.
Everyone watching would be interested in learning more about this remarkable treatment method, especially from a doctor who has extensive clinical experience with it.
I'm really excited about the opportunity to be here to tell people about the LCD Spinal Care System. LCD, by the way, stands for lumbar cervical decompression.
Before we go any further, why don't you tell us a little bit more about yourself, Dr. Lee?
Well, Andy, I'm practicing internal medicine, specializing in pain management.
And it's why we're interested in having Dr. Lee talk to you about the LCD Spinal Care System. He's considered an expert in the field of spinal biomechanics, the study of the structure of the back. And he's always looking for new answers and treatments that can take a patient's back pain away. And he thinks he's found one in the LCD Spinal Care System. Dr. Lee?
Absolutely correct.
So, if you're watching us right now and you're suffering from back pain, leg or hip pain or arm pain, or you know someone who's got unsolved back problems, do them a favor. Call them on the phone and tell them to tune in. Because for the next half hour, we're going to be telling you about a revolutionary back pain treatment that doesn't involve drugs, doesn't involve risky surgery, doesn't involve difficult exercises, and it's safe and proven to be effective for thousands and thousands of people, many of whom are now entirely free of pain.
The medical communities are very excited about the LCD Spinal Care System. And by the time we're done with our show here, I think you'll be excited too.
I'm sure they will be, Dr. Lee. But before we dig into this fascinating topic, I'd like our viewers to learn some things they may have never known about back pain.
45% of adults on disability are disabled due to back pain, the single biggest reason in the U.S. More than 65 million Americans experience back problems every year. Only the common cold causes more people to miss work. Americans spend at least $50 billion each year on treating back pain. Almost 6.5 million people in the United States will be treated for back pain today.
And now we're going to show you how you can get your back back with the LCD Spinal Care System. Right, Dr. Lee?
That's right. It's definitely an alternative that anyone with back pain should investigate. That's my opinion, but based on published data and my own experiences treating my own patient with this type of therapy, it's the way to go. The LCD Spinal Care System is a relatively new type of treatment. For many patients, it's an alternative that many professionals like myself are recommending, either before more risky or invasive courses of treatment are considered, or where more traditional chiropractic or physical therapy methods have failed to relieve the patient's pain.
And why is that?
Well, let's look at what else is out there. There's the painkillers, the muscle relaxants, which are drugs. There's physical therapy, there's bed rest, and finally, there's surgery.
Why and when would you choose the LCD spinal care system over other treatments?
Due to its excellent clinical track record, it has become my first choice for many cases. And unlike surgery, it's non-invasive, and I feel that it's very important.
And we'll go further into that in a moment.
Yes, that's right. We've got some information about surgery that may surprise our audience. But back to the other treatment methods. Compared to typical physical therapy, many patients tell us LCD takes less time and can cost less money.
Really?
Bed rest? Yes, but that can also help. But how long can you afford to lay up in bed? Most of us have jobs to go to, and additionally, after just a few days in bed, you begin to lose muscle strength. And finally, drugs. Obviously, there are a lot of issues there. Risk of addiction and side effects that can endanger the kidneys, the liver, and other vital organs. Also, it's been proven there are really no drugs effective for sciatic leg pain. And muscle relaxants are just sedatives that restrict driving and many daily activities for most people.
I tried massaging by myself, taking medication to relieve the pain. It did temporarily, maybe 1 to 2 hours, but the pain just came back, and I knew I couldn't take medication forever.
I had checked into some other type of things. Of course, I went for 4 years after the surgery with a lot of limitations, and I didn't know that I would ever be able to get back to normal.
Not good.
No, not good. Let's talk about something that we don't talk about a lot, is the failure rate of back surgery.
So you mean people go through all that risk, the anesthesia, the chance of nerve and muscle damage, and the pain of recovering from an operation.
Right.
And the scarring.
Right.
And then there's the time that it takes to get back on your feet again. People go through all of that only to find out that it didn't work.
That's correct. They end up back where they started, back pain-wise, or even worse. It's called failed back syndrome, and it's a surgeon's and their patient's worst nightmare.
You don't hear about that part of it, do you?
No, not often enough. But now, with the LCD spinal care system, if you've got back pain, you've got a new alternative. And its rate of success is much higher. Approximately 7 out of 10 patients feel relief of their back pain with LCD.
And that's without all the drawbacks of the other treatment options that you just covered a moment ago.
That's right.
Well, that's amazing. I mean, for our audience out there, the LCD spinal care system really sounds like a major advance in back treatment. Is it?
In many ways, it is. But it's based on some very logical and intuitive and scientific medical principles.
The LCD spinal care system works by actually allowing the spine to stretch in a very precise and controlled way. Because the stretching action is extremely gradual, actually controlled by a computer and biofeedback, the discs between a vertebrae are actually stretched, creating a vacuum-like effect. This vacuum can, in some cases, help retract or draw in a herniated disc that may be pinching a nerve, as shown here.
Some patients feel relief after their very first LCD spinal care session. Some 7 out of 10 patients that come in for LCD walk away with their back pain problems dramatically improved or eliminated.